Dr. Alois Kamuragie, Mrs. Andrea Grosvenor, Mrs. Karima Akins-Mitchell, Dr. Evangeline Springer, participants. Good morning and welcome to this workshop. I am Barbara Carby, the director of the Disaster Risk Reduction Center of the Institute of Sustainable Development at the University of the West Indies. So I will just give you a little background to the project which has brought us here this morning. Now, as those of us in disaster risk management and who have been involved in responses over the years know, psychosocial support interventions have been taking place for many years. Indeed, teams have been deployed in the past to provide psychosocial support to affected countries. The need for psychosocial interventions was reinforced in 2017, that very bad hurricane season we had with the two Category 5 storms that came through. And it was unanimous in all the debriefs after that season that there was a need to increase capacity in psychosocial support. Psychosocial support teams were not originally part of the response mechanism. Now, UNICEF, recognizing this gap, kindly provided funding to the University of the West Indies for a project called Enhancing and Integrating Psychosocial Support into the Regional Response Mechanism. This project had two major outputs. You have to mute. One was a skills inventory, which is a database with volunteers who will be deployed after an event to give psychosocial support in affected countries. Now, these volunteers, of course, are all trained and qualified persons in the field. A second output were the standard operating procedures for integrating the psychosocial support teams formally into the regional response mechanism, which is coordinated by CDEMA, the Caribbean Disaster Emergency Management Agency. Now, this workshop introduces the psychosocial support team to these procedures. I would like to recognize the important contribution of UNICEF to the effort and to thank them for so kindly providing the funding support which made the project possible. Another UWI partner is CDEMA, the organization, as I said, which coordinates response across the CARICOM states and which manages the regional response mechanism. CDEMA is an important partner here for several reasons. One of the main ones being that CDEMA will be a key resource for sustaining the project outcomes over time. And the database and the procedures will actually be handed over to CDEMA at the end of the project. So that was by way of a brief background. It now gives me great pleasure to introduce Dr. Alois Kamuragie, who will bring greetings on behalf of UNICEF. Dr. Alois?
I would like from the outset to recognize the tenacity UE has demonstrated to make this partnership with UNICEF work despite a couple of challenges. You know, at UNICEF, when we have this kind of partnership with project timelines, the managers, that was the case for Heather Stewart, who was the main manager of the side of UNICEF, looking at the timeline, the completion. Of course, at some time, it was clear that there were a couple of challenges. I don't get into the details. And of course, I take this opportunity to thank CDEMA for their commitment and support to ensure that psychosocial support is integrated into the CDEMA Regional Response Mechanism. You know, this didn't happen overnight. The events of hurricanes in 2017 brought the need for psychosocial support to the fore. As you well know, humanitarian emergencies can have significant impacts on an individual's psychological, social, and emotional well-being. These impacts can be acute in the short term, and if left untreated, can have long-term consequences that undermine the mental health and psychosocial well-being of the affected population. Mental health and psychosocial support programs are one way of seeking to reduce negative impacts and to provide aid to the affected populations. When CDEMA, together with development partners and UE, undertook a structured review of the response process to the 2017 hurricane-stricken countries and territories, we analyzed what happened, why it happened, and how it can be done better by the participants and those responsible for the process. In terms of mental health and psychosocial support, the review found that, one, the integration of mental health and psychosocial support into existing local systems and structures would better meet the varying complex and long-term needs of those affected by the crisis. And evaluation are weak and do not provide clear and comprehensive evidence of the numbers accessing and benefiting from mental health and psychosocial support. Three, having sufficient numbers of trained mental health and psychosocial support providers is essential in ensuring that a range of programs are delivered as planned. Four, thanks to modern communications, word of these tragedies reached the international community within minutes. And in some cases, relief was mobilized. It was mobilized in a matter of hours. This outpouring of assistance helps indeed disaster-stricken countries and territories. But there were also eyebrows raised. Who were these external entities offering psychosocial support? With whom are they registered? Who should be coordinating them? Lastly, coordination needs to be strengthened among all actors and across groupings, and governments need to take a more active role and include mental health and psychosocial support in their national policies, and it must be done within the existing Caribbean disaster emergency management institutions. I remember Mr. Jeremy Collymore at that time in his role as resilience consultant to the UE. He was ardent in his quest for resources to tackle the area of coordination. He saw this as part of the UE's commitment to strengthening its capacity to support the Caribbean region in the development of a culture of resilience and resilience planning. Not only must governments as well as resident and non-resident development partners respond, however, we need to do it in ways that do not harm and in ways that are known to recipient governments and coordinating partners. Therefore, the protocols on integration of mental health and psychosocial support are designed as a guide for members of the psychosocial workforce. While we know that there are many more issues to be resolved, UNICEF is happy that this collaboration with UE has helped to identify you, the experts, and to put an SOP, a standard operating procedure in place for the activation and coordination of your services should the need arise. A bite-sized approach to a big challenge, one would say, but UNICEF, Eastern Caribbean, and other development partners are determined, we are determined to support the Caribbean nations in this journey. To end my remarks, I hope this is not the end of the partnership with UE and CDEMA to strengthen the capacities of countries and territories across the Caribbean to ensure that they are very well equipped to deliver mental health and psychosocial support in any circumstance, whether it's development or humanitarian. This is to say that UNICEF, we are ready to go beyond this initiative. We will always be ready until we ensure that whenever this kind of services is needed across the Caribbean, that the duty bearers have the capacity to respond to all those who are in need without any exclusion. All the Caribbean people should access mental health and psychosocial support in any time. Thank you for your attention.
Thank you, Dr. Alois, for bringing greetings on behalf of UNICEF. And of course, we thank UNICEF for its financial support for this project. We now go to Mrs. Andrea Grosvenor, the Acting Deputy Executive Director of CDEMA, who will bring greetings on behalf of CDEMA.
Thank you very much. Dr. Alois Kamurugi, the representative of UNICEF Eastern Caribbean Office, Dr. Barbara Carby, the Director of the Disasters Reduction Center of the University of the West Indies, our facilitators, Mrs. Karima Akins-Mitchell, Dr. Evangeline Innis-Springer, and Captain Robert Harewood. Participants, good morning. On October 10, 2020, the global community observed World Mental Health Day. The need for investment in mental health is now much more profound in this unique year of 2020 with the COVID-19 pandemic outbreak, which has resulted in considerable alterations to daily lives and experiences of all people. The foundations of many things we found some measure of security in have been shaken. And according to the WHO, given past experience of emergencies, it is expected that the need for mental health and psychosocial support will substantially increase in the coming months and years. According to a 2007 article in the European Journal of Psychiatry, Natural calamities such as earthquakes, hurricanes, cyclones, and floods are some of the traumatic disasters that may cause post-traumatic stress disorder. Natural disasters can be severe, cause mass destruction, and affect millions of people, placing a strain on the mental health. In post-trauma scenario, raised degrees of stress could lead to depression and other mental illnesses, especially among those who have lost their loved ones and livelihood. The breakdown of traditional community structures, the loss of family support systems, long distance immigration, and economic uncertainty all take their toll in the form of a rise in mental disorders. Research shows that people who lose family members suffer from severe, significant psychological distress compared to those who do not. Women have been seen to be the most suffering victims in this regard. People exposed to such events are far more likely to develop psychiatric disorders such as substance abuse, major depression, and psychosomatic illnesses, which can present as an isolated disorder or as a part of post-traumatic stress disorder, PTSD. Rescue workers and medical teams are also equally prone to develop any kind of mental, psychological, and psychosomatic disorder. The rapid review of the regional response to Hurricanes Irma and Maria events undertaken in 2017 by CDEMA in collaboration with the University of the West Indies and co-funded by UNICEF, Global Affairs Canada, and DFID highlighted the psychosocial needs of the impacted countries in the region, hence underscoring the decade-old messages of the European Journal of Psychiatry. In fact, one of the striking findings of the rapid review in quoting the PDNA report was that Dominica reported that both sexes interviewed indicated a reported increase in mental instability and psychosocial need, especially for men and boys who reportedly had not been employing healthy coping techniques, and an increase in drug and alcohol use. Affected persons identified psychosocial support as one of the priorities, in some cases rating that above issues of security. In addition, the matter of the lack of and need for psychosocial support for persons working in response operations was raised multiple times and across countries. Hence, the need for establishing guidelines and operational procedures for inclusion of psychosocial first aid services during and after deployment was highlighted as a key need. Moreover, psychosocial support was highlighted as a need amongst initiatives which provide longer-term value and hence encouraged not only immediately, but buttressed by monitoring and managed for continuing post-impact psychosocial support. On behalf of the Executive Director of CDEMA, therefore, we laud the UNICEF and UE on this initiative, and we join with you in highlighting the importance of this workshop today. As we seek to have codified protocols for the integration of psychosocial practitioners into the regional response mechanism, we also want to acknowledge the collaboration with CAMPA in making this a reality and the ongoing conversation with CDEMA, certainly as a sign of the region's commitment in moving this forward. CDEMA is definitely committed to working with our partners for this timely integration into the regional response mechanism, as we leverage the collective capabilities of the region to provide support to an impacted state, not only for bouncing forward in the physical environment, but also embracing the social and psychological dimensions. I also want to encourage all that in our journey of providing psychosocial support to the region, let us acknowledge the contribution that our faith has made in the lives of Caribbean people traditionally, and leverage the best parts of this as one of the tools in this valuable toolkit for producing a more resilient Caribbean, not just physically, but mentally. We at CDEMA look forward to a successful workshop and working with our partners in ensuing successful outcomes. Thank you.
So that brings us, ladies and gentlemen, to the end of our brief opening ceremony. I want to thank both Dr. Alois and Mrs. Grosvenor again for joining us and bringing us those greetings, which gave us a perspective on psychosocial support and its importance generally, but also of the regional situation. So thank you both very much.